My name is Jessica Denson. It is fall 2019 semester. I am in veterinary nursing care, and the course number is 2439, section 31420. Alright, we're going to perform the heart and lung auscultation. I'm going to go ahead and start on the left side of the patient's body. Make sure that your patient is in standing, not sitting or sternal recumbency. That way you can get the best auscultation of the heart and lungs. And then we want to make sure when we do our lung auscultation that the patient's muzzle is closed and that they're not panting. Of course, if we're in respiratory distress, that's less of an option. But our patient is healthy. So we're going to listen on both sides of the chest, behind the elbow, where the costochondral junction is. So we're going to listen on this side for the pulmonic, aortic, and mitral valves. And then you want, when you're listening to your patient, you want to listen for full 2 to 3 cycles. And we're just going to move the chest piece around just very lightly to assault in that vicinity of each heart valve. So, start down here. Okay, and we've got a pretty good, we can hear our heart pretty well right here, so I'm going to count the heart rate. When we're counting the heart rate, what we're going to do is count the number of beats in a 15-second period and then multiply it by 4 to get our heart rate. Okay, so our patient had 25 beats in a 15-second period. Multiply that by 4, you get 100 beats per minute, and so that is what our heart rate is. The sounds that you hear in the heart is the first sound is like the lub. That's the mitral tricuspid valves closing, and that's at the start of systole. And then that dub, which is kind of the second sound in that lub dub heartbeat, is the aortic and then pulmonic valves, and that's just at the end of systole. So, we get the lub dub, and then there's this third sound that you might hear. It's pretty common in dogs. It's gallop rhythm, and basically, it's also referred to as a gallop rhythm. Basically, it's not abnormal electrical activity, and so that's something to be aware of. Things that you would want to listen for with a heart is heart murmur, sounds like whooshing sound, abnormal heart rate, or like a rhythm would be something like an arrhythmia. So sometimes people relate it to listening to a shoe and a dryer. It just, kind of scatters all around, and you don't really have a good number that you can identify with the heart rate. And then we're going to listen on the left side here with the lungs. We're going to assault the lungs as well, and we'll go through that, and then we'll turn her and get the right side. So there are 9 quadrants that we need to be listening for on both sides of the thorax. We're going to assault 2 to 3 respiratory cycles, and then that's on inspiration and expiration. So we're going to listen for intensity, any kind of crackles, any wheezing. We need to listen for stridor, which is just that high-pitched sound, and then any kind of panting or failure to appreciate any airflow through the lungs. That's really, really important. So we're going to have our restrainer hold the muzzle. And I can hear the respiratory rate pretty well here. So I'm going to, similar thing with getting our heart rate, we're going to collect the respiratory rate. So it's the number of breaths in a 15-second period multiplied by 4. So the respiratory rate that I got was 14 breaths in a 15-second period. So we're going to multiply that by 4. What is that? 56. So with the respiratory rate, I didn't hear, or with the lung auscultation on the left side of the chest, I didn't hear any abnormal crackling, wheezing sounds. I did hear air flowing in and out of the lungs, as you should. It's important to know any kind of changes or absences of sounds as well. Right side, we're going to listen for the tricuspid valve. So this is the only valve on the right side of the heart that we should be listening for, but we're going to be listening for about 2 to 3 cycles of the heartbeat, and that way we can get a good, accurate reading. And again, it's at the level of the costochondral junction, which is usually like right behind the elbow. And the other thing that you want to listen for is the character. It's also kind of like a pulse or beats of equal intensity and loudness. Want to make sure that we're not hearing differing loudness or intensity with each heartbeat. Want to make sure that they're the same. We're having the same pulse throughout. Of course, any kind of excitation or nervousness can increase our respiratory and our heart rate, and that's important to note as well. Okay, and then we're going to listen to each of the 9 quadrants on our lungs here. So I'll just start at the top and listen for about 2 to 3 cycles each. You hear the air moving through the lungs well. Another thing that's important to know is with the lung auscultation is the effort required to breathe, so AZ versus abdominal involvement. So if we're using more of our abdomen to try and breathe, it's most likely that we're painful or struggling to breathe for some reason. Perfect. EKG on max. It's important to have them comfortable in right lateral recumbency. So we're going to start by placing our leads. So we'll place our right lead just below the elbow on the front right leg. And then we'll go ahead and place our black lead on the left front leg, again, just below the elbow. Our red lead will go just below the stifle, and it's best to put them lower on the limbs because you get less interference as opposed to putting them proximal to the body. And then we're just using alcohol as a conductive mechanism to perform our EKG. It is helpful to make sure the limbs aren't touching while the EKG is being performed. That way we get less interference. It's also important to make sure other nearby electrical items aren't plugged in to decrease any kind of 60 cycle interference. So we've got our EKG printing out right now, and we'll go ahead and take a look and identify the components of our EKG with him as well.
Okay, do you want her to show that?
Yeah, that would be great.
Good, that we can show this. Anything else you need?
Electrodes on the left side of the body are both negative electrodes, and then our white electrode is positive. Discuss the parts of Max's EKG. So we're going to identify the first part of the EKG, which is P. It's kind of our first little hump here. And with our EKG, it's a little bit harder to tell on this patient because we do have a little bit of different heart rate. So with the P, going on this little section right here, and I'm going to do it on different sections of different EKGs, that way we can properly identify it. So the P wave that we have here is the atrial, where the atrial depolarization is caused by the pacemaker cells and that SA node. So that initiates an impulse, and then it goes through the atrial myocardium. And then we're going to move on and identify our Q. So our Q is this, let's see which one's a good one to identify. His stuff is all over the place. Okay, we'll just use this section here. So this is our Q. And this is where, this is after that impulse conduction via the AV node. So our impulse conduction velocity increases dramatically. The bundle of His and the left and right bundle branches and Purkinje fibers, they are transversed by the impulses, causing almost simultaneous left and right ventricular depolarization. So this is the Q, R, and S complex that we're talking about. So the R section that we're talking about is here. So this is our R. And then the S is just at the very end of the section. So I'm actually going to do it over here so we can see it and things won't be so congested there. So the S is just this little section at the bottom of our wave. This is where we're going down. And then, so we've got the QRS complex, we've got the P wave, and now we're ready for the T wave. The T wave is ventricular repolarization, and so that is this section here. Okay. The paper speed for our EKG is 25 millimeters per second, per second at a voltage sensitivity of 10 millimeters per millivolt. Use on a rabies catch pole is usually used with dangerous or unpredictable dogs. It's best to have a leash attached to them. Sometimes if the dog is bigger and stronger, it's best to have two people with two leashes. To use the rabies catch pole, you just slip the loop around the animal's head, pull it at the end here so that it tightens. We're not going to slip through, and then you've got control, and that way you can move the animal. You can keep a safe distance from them, and then to release, you'll just pull on the lever, flip the knot over their head. Okay, for cleaning the kennel, we use a dilution of Rescue. So with our Rescue spray, we just need to leave this on for a contact time of 1 minute. So we're going to spray all sides of the kennel. We need to make sure it's properly saturated so that all sides of the kennel get proper contact time of 1 minute. So we're going to wait for that to reach its contact time, and then we'll go ahead and clean it. When we clean the kennel, we start with the top of the kennel. Theoretically, it's the cleanest part of the kennel. So we'll go from the top, move to the back, then to each of the sides, and lastly we'll do the bottom, which is usually the dirtiest part of the kennel. That makes me cough.
Same here. And you're at 55 seconds. And a minute.
Okay, so now that we've had a minute of contact time, we'll go ahead and start at the top of the kennel. And you just want to clean in circular motions, overlapping each stroke. And that way we get each part of the kennel and not missing anything. Schirmer tear test. So our first step is we're going to fold the paper strip just at the little notch at the end there, and that way we're not touching it, getting our oils or contaminating the strip with anything on our hands before we administer it to our patient. So we're going to open the package here and be sure not to touch the end of the strip. We're going to place this in, oh sorry, that one. We're going to place this in the lateral canthus of the eye. So what you can do is just very gently pull back on the lower eyelid. We're going to place it in the lateral canthus. Make sure we're not placing it in the medial canthus because that is where the tears are produced. So we're going to time this for 60 seconds or until we reach 15 millimeters on the Schirmer tear test to measure our tear production. And then you want to hold the eye shut, make sure the strip stays in the eye during the entire test. Good girl, good girl. Okay, so it's been 45 seconds and our patient is now at 20 millimeters on the Schirmer tear test, so her tear production is normal. Any number under 15 millimeters does indicate a decreased tear production. Button here, so it makes it a lot easier. Okay. We're using the Tonovet to perform our tonometry. The Tonovet does not require calibration, and we don't use proparacaine to numb the eye. The sensor has a very delicate touch, and then if we use proparacaine, it can decrease or skew the results of our tests. So for the Tonovet, we're going to hold the sensor 4 to 8 millimeters away from the cornea. Want to make sure that the sensor actually touches the central cornea, and then we're going to perform 6 individual readings to get an average of those readings. So hold the Tonovet perpendicular to the table.
It's okay, it's just a sound. Good girl.
Okay. What was the pressure? 11.
What's normal?
Normal is 10 to 20 millimeters.
Good.
This is the corneal fluorescein stain. So you want to start by removing any kind of debris from the eye itself. You can flush the eye a little bit with some saline to remove any discharge on the eye without injuring it. And then once you've removed any debris, go ahead and take a drop or 2 of your stain and apply it to the eye. Okay, and then you can hold the eye closed or let the dog blink to get the stain covered around the eye. And then before you look at the eye with the cobalt blue light on the ophthalmoscope, you want to just gently flush the eye, remove any excess stain, and then any stain uptake that we have will look, it will fluoresce green under the light. Okay, now we're ready to look at it. We're going to examine the eye with the cobalt blue filter. So we do have a little bit of stain uptake in the eye, and the stain uptake does indicate a corneal ulcer.
Alright, for an anal gland expression, make sure to wear gloves, make sure to have either a paper towel or some wipes ready when you're expressing the anal glands, and then also use non-spermicidal water-soluble lubricant. So we're going to start by having our holder restrain, and then go ahead and put some lube on the tip of your finger. The anal glands are located about 4 and 8 o'clock in the just like right inside of the rectum. So just gently insert your finger, and then we will just very gentle, even pressure express the anal glands. And what you should feel is that anal glands start to get smaller as well. Okay, good girl, good girl. Alright, and then we'll do the other one. Same concept, just gently insert your lubricated finger, index finger into the rectum. And then with your thumb, helps to brace the anal gland. And then just gently express the anal gland. There we go. Good girl, Pippa. Good girl. And then we use rescue wipes to wipe off the rectum there.
Okay, we're going to prepare our warm water enema solution. So I've had this water heating up here for about 5 minutes or so. So what we're going to do is use a basically 1-to-1 solution of the non-spermicidal water soluble lubricant jelly. And so the first thing that I'm going to do to create a 1-to-1 solution is I'm going to use the half mark at the cup to measure an appropriate amount of water. And we want the water warmer than the patient's body temperature, but not cold. Okay? Okay, perfect. So now that we have half a cup of the warm water, what I'm going to do is just use displacement to measure out the amount of lubricant that I need. And then the top of this red line will give us 1 cup, and that way we have our 1-to-1 enema solution. Just gonna pour it into this bowl here. I'm gonna stir it around, make sure it's nice and homogeneous. Everything's mixed in together well. Lukewarm water and water-based lubricant solution.
We're not going to actually give our enema solution. Our patient doesn't need one. We're going to demonstrate how to give the enema solution. Our patient does not actually need an enema, so I'm just going to go through the steps of how to give one. We use enemas to, we give enemas to animals with constipation to help facilitate defecation. So we've got a 60 milliliter syringe here. We would go ahead and collect a solution into the syringe, and then you would want to make sure that the tip of the red rubber catheter is very well lubricated. That way when we insert it into the rectum, we can just very slowly just move the red rubber catheter back and forth into the lower gastrointestinal tract. And then what we would do is we would connect the end of the syringe with the end of the red rubber catheter. And then with calculation on the amount to give the enema solution, it would be 5 to 10 milliliters per kilogram of the patient's weight. That way we can collect the appropriate amount of enema solution and administer more if need be. So we would advance it slowly up into the lower gastrointestinal tract, and then you would probably want to take your patient outside so that it can remove the bowels, so that it can defecate. To apply Revolution Plus to Sylvie, this is a topical medication for the prevention of heartworm disease and control of flea and ticks. So with any kind of topical medication, it's really important if it's not specifically labeled for the eyes or to be ingested, that we make sure we do everything we can to prevent that. So specifically with topical medications for heartworm, flea, and tick control, we're going to put this up high on the neck, and that way she can't turn around and lick that off and ingest it orally. Medications can be very harmful if they're ingested orally. So what we're going to do is just separate the hair on the back of the neck. Make sure you get direct contact with the skin, and then apply the medication to that area. And After you've applied that medication to the area, make sure you don't touch it. Wash your hands really well if you do touch it. That way you don't cause any contaminant on your own skin or eyes and mouth as well. Performing the ear cleaning on Bear, we're going to use Epiotic to clean the ears out. Place some of the ear cleaning solution on your gauze. Go into the ear, that horizontal canal. Okay, we're going to clean it out really thoroughly. Okay, we're going to use some cotton-tipped swabs to clean the ears out. Just very lightly clean out the outer ear. Good boy. Okay, and then we're going to use a clean, dry gauze to just wipe any excess ear cleaning solution out. Try and get any excess debris or earwax. And then we're going to grasp the ear at the pinna. We're going to pull it up and then slightly outward. And then we're going to place the applicator into the horizontal ear canal. There we go. And then we're going to massage at the base of the ear so it disperses the ear medication thoroughly. Clean Sylvie's ears and then apply a clear to treat the ear infection. So we have Epiotic Advanced. What we're going to do is go ahead and grasp the pinna and then put the ear medication in until it's creating a waterfall. And then you want to massage at the base of the ear really, really well until you get that nice squishing sound. And then let the animal shake their head, and that way they can loosen any debris that's down in the horizontal ear canal, and hopefully we can remove that. So you can take cotton balls or you can use gauze to remove the debris in the ears. It's really important that you don't use Q-tips if you're not well trained, because you can injure the eardrum and you can cause harm to the structures of the ear. Good girl. And so we see that we're removing a lot of that debris from her ears. Go ahead and give it a nice good thorough clean before we put the ear medication. Good girl. Okay. And then with the ear medication, it's really important that we insert it into the ear canal here, like so, and then give it a good squeeze. And then before you let go, massage again at the base of the ear so that that medication really gets in there. And then our patient's ears have been cleaned and medicated. Good girl. Alright, we're going to demonstrate how to administer subcutaneous fluids. We administer subcutaneous fluids to patients who are moderately or mildly dehydrated. It's just a nice natural way to absorb fluids over about 24-48 hour period. So we have an isotonic fluid. It is lactated ringers, and then we also have a 16 gauge needle for our fluid administration. You want to use a bigger needle to allow for better flow of the fluids through the bag. So right now the clamp is down and it's secured and closed to the line. So we're going to go ahead and open it after we place the needle under the skin. We're going to place the bevel facing towards the patient's head, and then we're going to hold or find an area of skin over the the dorsolateral region of the shoulders and neck area. That's usually where you'll have the most amount of skin that's loose. So you can grab and tent or lift the skin. Go ahead and make sure your bevel is facing towards the patient and enter the skin at a 45-degree angle. And then make sure it's seated there comfortably. We're going to unroll the clamp upwards, and that's going to allow fluids to flow into our patient. We need about 40 milliliters of fluids for a very mildly dehydrated patient, and you can see that our fluids are flowing well right now. So we're going to hold the fluid bag about 3 feet above the patient, and that way we can administer fluids using gravity. Okay, so our fluids are flowing nicely, as you can see. Good girl. Okay, and then we can check the top of the bag as well to help us determine if we're there. And we have reached our fluid administration dose. So now that we've administered the fluids, I have rolled the clamp to the bottom, which has secured and closed to the line again. I'm going to place our bag back on the table here, and then when I remove the subcutaneous fluids, I'm going to pinch off the area of skin where the needle was inserted, and that way we can prevent any kind of or decrease the amount of fluids flowing out of the injection site. And you can do that for about 60 to 90 seconds. Having a nail trim on her. So we're going to start with either the front or the back paw. We don't want to trim too close to the quick. With dogs with black nails, it's a little bit harder to see. She does have her nails trimmed about every week or 2 weeks, so I'm not going to trim a whole lot on her. Okay, here we go. Good girl, good girl. And so we don't want to hit the quick. With dogs with clear nails, it's a little bit easier to see the pink part of their nail. In case we do trim the nail too short, we do use quick stop to stop the bleeding. You can also use silver nitrate. You can use both of those on cats as well if you trim the nails too short. But go ahead and trim about 2 to 3 millimeters before the quick. That way we don't hit the painful part that does bleed. We're going to do a nail trim on our cat Sylvie here. Same concept as the dog nail trim. You want, oh, I forgot she's the clip. You want to, cats' nails are a lot easier than dogs. You can see the quick on their nails, and so you just want to cut 2 to 3 millimeters before their quick, which is the pink part of the nail. Again, if you accidentally cut into the quick, that does bleed and it is painful, so you want to use quick stop. It's diptych powder. You can also use the silver nitrate sticks. Those also help stop any bleeding as well. This is the application of the emergency bandage. The purpose of the emergency bandage is to temporarily stop bleeding until emergency care can be received. So we've got our patient. We're going to do a 3-layer bandage, and so with this bandage we've got our Telfa pad. This will be our primary layer, and then we do have some rolled cast padding. It's rolled cotton cast padding, and then we have our vet wrap, and then I also have 2 strips of the elasticon tape to help secure the top and the bottom of the bandage material. So we're going to start by putting our Telfa pad or making direct contact with the area. She doesn't actually have a wound, so there's no shaving to be done, but we would put some sterile non-spermicidal water-soluble lubricant in the wounds prior to shaving, and that way we can avoid getting any kind of hair contaminant in the wound. So I'm going to act as if her wound is on the distal end of the left hind limb here. So we've got our Telfa pad here to stop the bleeding at the site, and then we'll go ahead and place our rolled cotton cast padding. And what we want to do with this is we want to make sure that it's tight enough to help provide compression. We also want to make sure that our secondary layer isn't full of wrinkles or anything, and then we want to make sure that we overlap each layer by about 50% with the next layer, and then we will also go at the joint proximal to the injury site. Okay. Good girl. Good girl. Okay. And then we do want to leave out our toes here so that we can evaluate the limb for any kind of swelling. If the bandage is too tight, that will help us to determine this. Okay, so we're done with our secondary layer. We'll go ahead and use our vet wrap now. The temporary bandage decreases dead space and protects the site from the pet and the environment. And then nice even compression. That way we don't get swelling at the proximal or distal end of the limb. And then same concept with this is 50% overlap. The only difference with our tertiary layer is that we don't want this tertiary layer to be touching any part of the patient. So this should just be touching our secondary layer. So we see we've got a nice even view of that. And then same concept as the second layer is we want to make sure we have 50% overlap with each of those areas. So we're going to put this off. Okay, secure it to the patient. And then that was our third layer, but again I'm using the elasticon tape to further secure the bandage to the patient, like so. And then like I said, you want to leave the toes out just enough so that you can go ahead and evaluate the patient for any swelling. Alright, for an oral administration of a medication, specifically a pill, we are giving Pippa trazodone. It's a 50 milligram tablet appropriate for her size. We also have some water to give after administering the pill. That way we avoid any complications associated with giving a dry pill. So we're going to go ahead and tilt the head back, pry open the jaws here, put the medication at the very back of the throat, and then you can hold the mouth shut, blow on the nose. You can also just very gently massage the neck to encourage swallowing, and then give about 1 to 2 milliliters of water after that medication. Administering oral medication to our cat Sylvie, so I'm going to hyperextend her neck so that the nose is pointing up towards the ceiling. Use my fingers to open the lower jaw, and then I'm going to place the pill at the back of her throat. Good job. Close the mouth and then just gently massage the throat to encourage swallowing. Use 1 to 2 mils of water to help bring that pill down through the esophagus. Alright, we're going to get started with our modified Robert Jones bandage. We have our patient Pippa here. We'll be using her left hind leg. We have our split spoon, and then we do have our stirrups, one for each of the medial and lateral aspects. We have rolled cotton cast padding. We have our tertiary vet wrap layer, and then we have our primary layer, Telfa pad. To start by applying these stirrups to each of the limbs. And so we've got our first stirrup here, and then our second stirrup on the medial aspect of the leg. And this is just to help the bandage from slipping. Okay. And then we're going to apply our Telfa pad. Okay, and we're going to start with our rolled cotton cast padding. So we'll start at the bottom and then work our way up. We do want to make sure, very, very important, that we leave the toes exposed, or a couple of the toes exposed. That way we can monitor for any kind of swelling with our bandage. And then just like the emergency bandage that we applied, we want to do a 50% overlap, and then we're going to go up at the joint proximal to the injury. Okay, make sure we don't have any wrinkles in any of our layers, and we want nice, even pressure applied with each layer of bandaging. Okay, and we want to apply about 2 to 3 layers of our secondary and tertiary bandage. So it's going to be fairly thick bandage, but it is less thick than the Robert Jones bandage. Okay. Good girl. Okay, so now we are done with this layer. Alright, so now that we've got our secondary, the first secondary layer of the cast padding on the leg, we're going to remove the stirrups from the tongue depressors, from the, right? Okay. And then twist them and then fold them up, and that way they are on the cast padding here. I don't know if you can see that. Okay, and then we're going to place our aluminum splint and make sure it's seated comfortably, and then we're going to do our second layer of the gold cast padding to secure it to the patient. Same concept as before. Make sure we've got 50% overlap, we've got nice even compression with no wrinkles, no material. Secure it to the patient there. Good girl. Good girl, Pippa. Good job. I know that noise startled you. Okay. Alright, now that we've got our secondary layer down, we're going to go ahead and apply the vet wrap. This is our tertiary layer. We want to make sure we go from distal to proximal, and then that our vet wrap is not touching the patient. We want to avoid any complications like causing sores or abrasions. We're going to do 50% overlap of each layer. Make sure there are no wrinkles, and then we're going to do about 2 to 3 layers of the vet wrap. And then we do want to make sure that this has moderate tightness. We do this with moderate tightness so that we get nice even compression, we get nice immobilization of this hind limb. Good girl. Okay. Good girl. Alright. And so the last thing that I prefer to do is add just a little bit of a security blanket with the elasticon tape. I put it at the top and the bottom of the patient. Normally, I'm just going to put it at the top in her case, and that way we can make sure that the bandage is absolutely secured to the patient. Helps to decrease any kind of slipping as well of the bandage. Okay, so we've got that, and then you can also see we've got our toes, 2 toes exposed here, actually 3 toes. That way we can check for any kind of swelling, make sure that the bandage isn't on too tight. And then we're going to go through the process of removing the bandage, the modified Robert Jones bandage. With the bandage, we're kind of going to do the opposite of what we just did. We're going to unwrap this first layer of the vet wrap. Remove our elasticon tape here. And that elasticon tape just kind of helped to reinforce our bandage there. So we're going to remove all of this. Good girl. Good girl. Okay. Can you remember if they unwrapped this one and then cut for the second one?
I think so.
So we're going to unwrap the second layer of the cast padding, the gold cotton cast padding. Good girl, Pippa. Just make sure you can see it. Good girl. Okay. And so our aluminum splint came right off after unrolling that layer. And then we're just going to very carefully use our bandage scissors to remove the final layers of the bandage material. So just make small, controlled cuts through the layers, and that way we can make sure we're not injuring the patient. Good girl. Make sure the patient is comfortable. Okay, good girl. Alright, and then that way we have the bandage removed, we've got our Telfa pad removed. And then we're going to remove the stirrups as our last step. Good girl. Okay, she can stand up.
Good job.
Good girl.
Good job.
Good girl. Alright, and that is how you apply and then remove a modified Robert Jones bandage. Okay, with the canine x-ray, we're using the bisecting angle technique. So the x-ray beam is going to be projected on this imaginary line, goes ahead and bisects the angle formed by the plane of the sensor and then the tube.
Ready?
5, 6, 7. Okay. This one, we're going to get the premolars and then the molars. And so we're going to use the paralleling technique. So those sensors actually placed parallel to the long axis of the tooth, with the x-ray beam going at a 90-degree angle to the center of the teeth.
Okay, so now you're doing 7, 8, 9.
Yes.
Okay.
We took, so this is the canine tooth here. The outer part is the enamel. And then we have our root canal, and then this is the pulp cavity of the tooth, or the pulp chamber. We have the dentin, which is the radiodense part. And then we have our root apex at the bottom. Periodontal ligament is on the side. And then we have, you can see part of the mandible at the bottom here. So here we can see we have the ventral cortex down here. We have the enamel along the tooth up here and on the sides. And then this area is just the overlapping of the teeth. It doesn't mean that we have cavities or anything. It's just the teeth overlapping on each other. We have the furcation area right in here. Our pulp chambers, you can see, go along teeth. These are more radiopaque. And then we also have the dentin on the sides of the tooth. Root canal here at the bottom. We have the apex of the root on both of our teeth here. And then we do have our periodontal ligaments on the sides. And then this is our mandibular canal. So I'm going to do the hand scale, then the ultrasonic scaler, and then I'm going to do the polishing last. So we'll get started here in just a minute. Okay. Just be sure and get the patient on you. I'll start with the tartar removing forceps. It's used for removing heavy amounts of calculus. You just want to apply gentle pressure to remove the larger amounts of calculus before we get started with the ultrasonic scaling.
So with our ultrasonic scaling, this uses electrical energy that converts the working tip to mechanical energy in the form of rapid vibrations. It's used to remove calculus deposits and then the biofilm. It has the water-cooled vibrating tip, and we're going to angle this about 10 to 15 degrees from the long axis of the tooth. We're going to use the distal third of the working tip to remove the calculus. And then you just want to use about 15 seconds, you just want to use the instrument about 15 seconds per tooth. Use about 15 seconds of the ultrasonic scaler per tooth because you can actually damage the tooth. This is the Morse supragingival scaler. So we're going to take the working end and we're actually going to place it between the grooves. And when you're doing this, go ahead and use a modified pen grip for the instrument handling, and that way we've got best control. And this goes between the grooves of the teeth so we can remove any calculus buildup that the ultrasonic scaler did not get. Okay, so we can see that calculus buildup was removed. This is our Columbia super and subgingival scaler. So we're going to use this to clean the plaque and calculus from the tooth surface. We're still going to use the modified pen grasp for this, and we're going to hold it about 45 to 90 degrees to the tooth root surface. We're going to pull firmly against the tooth to remove any debris. That way we can make sure we've got all of the debris. With polishing our tooth surfaces, you want to make sure that we're not going all the way up to the highest possible rotations per minute. So go ahead and step all the way down on your pedal to figure out the sound that it makes when it is all the way at the highest rotations per minute. That's the sound we don't want to make. We want to use a quarter of the highest rotations per minute. So we're going to find that sweet spot, and then we're just going to slowly ease off of the pedal until we get that rotations per minute. Okay, so this is a nice even rotations per minute. It's nice and easy, it's gentle against the tooth, and it's not going to cause any trauma to the tissue or surrounding surfaces. So we're going to completely fill the rubber cup with our prophy paste. Want to completely fill the rubber cup with prophy paste for each tooth, and then we're going to do our prophy paste. Use light pressure, place the rim of the rubber cup against the tooth surface, and we're going to do that for about 1 to 3 seconds per tooth. With the polishing procedure, we are just using the prophy paste to smooth the surfaces that have been microscopically scratched during the scaling procedures, whether it was with the hand scaler or the ultrasonic scaler. Okay, and the prophy paste does help to remove any kind of extrinsic stains that we weren't able to get with the hand scaling or the ultrasonic scaler. No. And then we'll gently rinse the teeth to remove any excess paste.
Darby did great for her dental cleaning today. There are some home care instructions that I would like to go over with you to help maintain her dental health.
Yeah.
So this is called the Bass toothbrush technique, and basically you're holding the toothbrush at a 45-degree angle. Some of the
Okay.
bristles will go underneath the sulcus here, and then some others will be touching the nearby teeth as well. And so you just want to use a gentle back and forth motion on the teeth. It'll be for
Yeah.
about 10 to 15 seconds per tooth, and then go ahead and move on to nearby teeth. This will help to prevent the buildup of calculus and plaque on the teeth, as well as help to fight any kind of gingivitis that plaque and calculus help to develop. There are other home care things that you can do, like water additives. Enzymatic water additives help to break bacteria down. And then you can use Oravet chews. You can use the VeggieDent chews. Those are very safe. They're not too hard for your pet's teeth.
Okay.
They're not going to break your pet's teeth, and then they'll help also to maintain dental health.
Yeah.
You also want to avoid giving your pet the antlers and like bones, because those are too hard and they will break your pet's teeth or
Okay.
cause other dental issues. So make sure that you're not buying toys that are too hard for your pet as well. It's also important to feed your pet a therapeutic dental diet, such as Royal Canin and Hills have really good dental diets.
Yeah.
This is a dry, hard food, and it's specifically manufactured and tested to prevent and help prevent the further buildup of plaque and tartar on the teeth.
Use the lateral 1/3 millimeter of the cutting edge